Good morning. I'm Harry Erba from the Duke Cancer Institute in Durham, North Carolina, United States. And it's my honor to present the results of the QuANTUM-First trial in which Quizartinib was added to standard chemotherapy in newly diagnosed FLT3-ITD positive patients with acute myeloid leukemia. Here are my disclosures. I've received research funding and has served as a consultant to Daiichi Sankyo, the sponsor of the QuANTUM-First clinical trial. The purpose of this study was to evaluate Quizartinib, a potent and selective type II FLT3 inhibitor, combined with standard induction and consolidation chemotherapy, and continued as a single agent in adult patient ages 18 to 75 years with newly diagnosed FLT3-ITD positive acute myeloid leukemia. QuANTUM-First is an international, randomized, double-blind, placebo-controlled phase 3 study. Patients were randomized 1-to-1 to receive Quizartinib or placebo added to standard chemotherapy and then continued as a single agent for up to 36 cycles, including following allogeneic stem cell transplantation. The primary endpoint was overall survival, and the primary endpoint was achieved, as you can see here, with an improvement in the median overall survival with the addition of Quizartinib to 31.9 months compared to placebo 15.1 months, for a hazard ratio of 0.776, which has a two-sided stratified p-value of 0.0324. As expected in a study of AML patients receiving intensive induction and consolidation chemotherapy, almost all patients had treatment-emergent adverse events. The rates of grade 3 or higher treatment-emergent adverse events were similar for both study groups. However, the rates of grade 3 or greater neutropenia were higher in Quizartinib-treated patients. Grade 3 or greater QTc prolongation occurred in 2.3% of patients receiving Quizartinib, and 0.8% of patients discontinued Quizartinib due to QT prolongation. Ventricular arrhythmias events with Quizartinib were uncommon. The rates of TEAEs associated with fatal outcomes were 11.3% with Quizartinib versus 9.7% for chemotherapy alone, and were mainly due to infections. So in summary, QuANTUM-First showed Quizartinib added to standard induction and consolidation chemotherapy significantly improved overall survival in adults with newly diagnosed FLT3-ITD positive AML. The safety of Quizartinib in the trial was consistent with the known safety profile, and no new safety signals were observed. Thank you.